Good morning and welcome everybody for our second day of the pre-licensing. Hope you had a great day yesterday. Lots of content and we have more to come today. Really important stuff. Again, my name is Allison Espeseth. I'm the Director of Covering Wisconsin. And we're so happy to be hosting this in coordination and partnership with the Department of Health Services and OCI to present this really important information for you so that you can become certified application counselors, navigators, enrollment assisters broadly for Wisconsin. So today, I believe we're doing EBD Medicaid information from DHS, and then OCI will be coming on a bit later to talk about Health Insurance 101. Before we get there, let me just give a little bit more kind of other pieces of information that are important for you to know just for today and in general as you prepare. So we will be having an evaluation after these pre-licensing sessions. We'll share that out tomorrow. So keep an eye out for that. That's really important. We definitely look at those every year to help us improve the program and just make those tweaks and even bigger fixes just to help make sure that the content is shared in a way that's helpful and just the program overall is supportive of you. And you probably saw, and I think you comfortable with it yesterday, the Q&A function is really where you ask those questions. We don't have a online discussion or chat feature enabled. We really just use that Q&A just to make sure that people can access or pose their questions and make sure they don't get lost in a discussion format. There will also be an office hours offered to you, especially new, those who are getting trained to become new enrollment assisters this year. We find it's really helpful at the end of the whole conference just to bring folks back together just to ask questions. So Adam Van Spankeren, who you met yesterday, who is the Covering Wisconsin Navigator Program Manager, he'll be there to just answer questions that you might have of this content as well as the stuff that you'll be learning as part of the main conference next week. It's just an hour long. It's on September 13th, 2 to 3 p.m. And I think a link will be sent out directly to you if it hasn't already. It's just a Zoom link. There's no login or anything like that. It's not going to be on this platform. And if you can't find that link, it's also on our conference webpage. Just to go to that covering wi.org conference, I think is the / conference. If you just go to our website, you can find the conference webpage and it's on there, the link for that. And like I said, that's on the 13th. So it's next Friday after all the sessions. And then I also wanted to highlight that, and you hopefully saw it as part of the intro slides that were shared. We have a toolkit that's already available. This is really important as you help to raise awareness in your community, and just people like to have some sort of takeaway to remember how to get resources or that help is available. Either for themselves or for those that they serve. So if you go to our website, again, covering wi.org/toolkit, that's where you'll find all the resources and you can download them freely, print them as you want. There are, we try in our team, led by Stephanie Sievers and Jen Ball and Mike Moriarty, they really work very hard every year to create a wide variety of designs, and we have them in Spanish and Hmong and English, really just to help you reach different audiences. So do take a look at that. Like I said, you can just freely download them as you want, use them in your community. So yeah. So I think that's all I have to share for this morning. Again, welcome, and I'm happy to hand it over to, do I hand it over to you, Elizabeth?
Yes, yep.
Or directly to Nikki.
Good morning, everyone. As Allison said, thank you for joining us again today for the second day of pre-licensing. We are having presentations again from Nikki and Maciel at Department of Health Services and then later we will be with the Office of the Commissioner of Insurance. Our first session is about elderly, blind, and disabled Medicaid eligibility rules. And so I will hand it over to Nikki and Maciel so we can get started.
Sounds good. Thank you, Elizabeth. Good morning, everybody. Again, I'm Nikki Biddick, and I'm here to talk to you about elderly, blind, and disabled, or EBD Medicaid today. I did present both the Applying for Wisconsin's Healthcare Programs and the Badger Care Plus eligibility rules sessions yesterday. So if you were with us for one or both of those sessions, hopefully you're not too sick of hearing me talk yet. One more, I promise. This is it. Our session will end at 10:15 this morning, and the next session will begin at 10:30. As a reminder, if you do have questions, you can enter them in the Q&A in the chat in the Q&A box, and we'll address them at the end of the session as long as we have time. And as Elizabeth mentioned, my coworker Maciel is with me again to assist with questions. Again, if we run out of time if there are any questions we can't answer, we'll be sure to keep track of those and get those answers to Elizabeth so she can follow up with you all later. All right, the agenda for today includes going over the purpose of the training, an overview of Medicaid, including the non-financial and financial rules, as well as the sub-programs of EBD Medicaid, and then finally some resources. The purpose of this training is to provide navigators, certified application counselors, partners, agents, and brokers with an overview of the eligibility rules for EBD Medicaid programs. Medicaid for the elderly, blind, or disabled, also known as EBD Medicaid, covers adults age 65 and older and individuals who've been determined blind or disabled by the Disability Determination Bureau, or also known as the DDB. Many people will often confuse Medicaid with Medicare. So Medicaid is a joint federal and state program that provides high quality healthcare coverage, long-term care, and other services to over 1 million Wisconsin residents, and is the topic of our conversation today. Medicare is a health insurance program administered by the federal government and divided into 5 parts. Part A, which provides coverage for hospitalization and skilled nursing facilities. Part B, which covers such things as doctor visits. Part BID, which covers immunosuppressive drugs for those without other health coverage. Part C, Medicare Advantage, which is a supplemental coverage sold by private companies. And you may also have heard of that Part C being referred to as Medigap. And Part D, which provides prescription drug coverage. Again, Medicaid and Medicare are 2 different programs, and we're discussing Medicaid today. Let's first look at an overview of EBD Medicaid. As I mentioned yesterday, please keep in mind that this training provides an overview of the eligibility factors that will be considered for EBD Medicaid. It's not intended as a training on how to determine eligibility. Only income maintenance or IM agencies can determine eligibility for most programs. More information about specific programs and policies can be found in the Medicaid Eligibility Handbook, or MEH, which is found at the first link on this slide. And the policies described in this training are subject to change. Updates are available a couple of ways. The second link on this slide is a biweekly stakeholder call series hosted by DHS. It provides information about eligibility policy updates and rule changes affecting Wisconsin programs such as food share and Medicaid. And the last link on this slide, which was also given yesterday, takes you to a site where you can sign up to receive email updates regarding DHS programs and services. So full benefit EBD Medicaid includes many different programs. We'll start by giving you some basic information about each and then get into more detailed information about each one in a bit. First, we're going to talk about Supplemental Security Income, or SSI Medicaid. That's for people who are getting federal Supplemental Security Income, or SSI, payments. Individuals receiving SSI are automatically eligible for Medicaid and don't need to apply for Medicaid through the IM agency. So you may see this as state and federal SSI payments. And if an individual is receiving a federal SSI payment, they will also receive a state payment, and they will also automatically be eligible for Medicaid. They don't need to apply for Medicaid. They've already got it. Now, SSI-related Medicaid is the basic EBD Medicaid program for people who are 65 or older, blind or disabled, but who are not getting SSI. A Medicaid deductible allows people who are above the income limit for SSI-related Medicaid to become eligible for Medicaid after they have met a deductible. Special status Medicaid is for people who once received SSI but no longer do, and who meet the financial eligibility criteria for Wisconsin's SSI-related Medicaid after disregarding a certain amount of their Social Security income. Medicaid Purchase Plan, or MAP, is for individuals with a disability who are working or want to work. MAP has higher income and asset limits than SSI-related Medicaid and may require a premium payment. The Katie Beckett program is for children with disabilities living at home, in a foster care setting, or in another eligible community-based setting who require an institutional level of care. Because only the child's income is counted, it allows some children with special needs to qualify for Medicaid even when they have higher family income and may not be eligible for Badger Care Plus. Wisconsin Well Woman Medicaid is for women under age 65 who need treatment for breast or cervical cancer or certain precancerous conditions. Institutional Medicaid is for elderly, blind, or disabled people who are living in a nursing home, hospital, or other institution. And home and community waiver programs enable elderly, blind, or disabled people to receive long-term care services and supports in their own homes or in the community rather than in an institution. There are also some limited benefit Medicaid programs. Individuals eligible for these programs have limited coverage, not full benefit coverage. Emergency services covers services needed for the treatment of an emergency medical condition if the individual meets all program rules except for being a U.S. citizen or having a qualifying immigration status. Senior care is a prescription drug assistance for individuals who are age 65 or older. The Wisconsin Well Woman Program, WWWP, is a limited benefit Medicaid program. It provides women ages 40 through 64, with some limited exceptions to that age group, specific preventative health screening services related to breast and cervical cancers. The Medicare savings programs help individuals enrolled in Medicare pay their Medicare premiums, deductibles, co-pays, and/or co-insurance. So again, Medicare is that health insurance program administered by the federal government, has those 4 parts, A, B, BID, C, and D, actually 5, and it's not Medicaid. But the Medicare savings programs are Medicaid programs that can help people pay some of their Medicare costs. And we'll talk about that in more detail in a bit. First, let's take a look at some of the basic non-financial and financial rules for EBD Medicaid. Individuals must be elderly, which for Medicaid is 65 or older, or have been determined blind or disabled by the Disability Determination Bureau, or DDB, to be eligible for EBD Medicaid. As a note, some individuals may be eligible for what's called a presumptive disability determination. This is a method for temporarily determining a disability for an individual while a formal disability determination is being done by the DDB. Now, we're not going to be diving into presumptive disability information this morning, but I wanted to mention it because people often confuse presumptive disability with presumptive eligibility, when they're two different things. Remember, we discussed presumptive eligibility yesterday. That was that express temporary enrollment into Badger Care Plus or family planning only services based on the presumption of eligibility for those programs. Presumptive disability information can be found in Medicaid Eligibility Handbook, Chapter 5.9, while presumptive eligibility information can be found in the Badger Care Plus Handbook, Chapter 40.2. Okay, so individuals must be elderly, blind, or disabled to be eligible for EBD Medicaid. They must also be a Wisconsin resident, and they must be a citizen or a qualifying immigrant. Additionally, individuals must provide a Social Security number with a few exceptions. They must supply the required information and verification within the required time frame, and they must pay premiums or cost sharing if required by the specific program. Most EBD subprograms have an income limit and an asset limit, but those do vary by program. Income limits for some EBD subprograms are based on the federal poverty level, or FPL, while others are based on the SSI federal benefit rate, or FBR. All limits are federally determined, and most are adjusted, usually increased, yearly. Current FPL amounts for EBD Medicaid can be found at the link shown on this slide. Most subprograms count the income and assets of the member and their spouse. There are some exceptions that apply to children with disabilities, though. Children are not subject to an asset test, and in some cases, parents' income is not counted or is only partially counted. Countable income for EBD Medicaid includes, but is not limited to, gross earned income, self-employment earnings, Social Security income, retirement benefits, unemployment insurance, income from trusts, interest and dividend income, child support, and alimony. Income types and rules are outlined in the Medicaid Eligibility Handbook, or MEH, Chapter 15. Countable assets for EBD Medicaid include, but aren't limited to, cash, checking, and savings account, stocks, bonds, and certificates of deposit, or CDs, non-home real property, and then some vehicles, trusts, life insurance policies, burial assets, annuities, loans, and reverse mortgages. Asset types and rules are outlined in MEH Chapter 16. There are also some allowable deductions for EBD Medicaid, and those do vary by subprogram, but all EBD Medicaid programs allow a $20 standard deduction, as well as a 65 and 1/2 earned income deduction. The $65 and 1/2 earned income deduction is calculated by first deducting $65 of the household's total earned income, then deducting half of any remaining earned income. An example of this would be if a household has $1,065 per month in total earned income, $65 would be deducted, leaving $1,000. Half of $1,000 is $500. So the total deduction would be $565, and the countable earned income would be $500. There are subprogram specific deductions as well. So depending on the subprogram being determined, some examples of those subprogram specific deductions include support payments, court-ordered attorney or guardian fees, impairment-related work expenses, and medical and remedial expenses. And we're going to take a closer look at some of these sub-program specific deductions when we take a closer look at those programs in a bit. All right, that brings us to our first poll question. And as a reminder, if you click on the live poll link, you'll be able to answer that poll question within the live poll. Which of the following individuals may be non-financially ineligible for EBD Medicaid based on the information given? A, Janice, a 44-year-old who's been determined disabled by DDB. B, Edgar, age 68. C, Penelope, age 70, living in her home in Minnesota. And D, Ricardo, a 24-year-old who's been determined blind by the DDB. Which of these individuals may be non-financially ineligible for EBD Medicaid based on the information given? I'll give you a little time to answer that. All right. Looks like a majority of you got the correct answer, which is C. Individuals must be a Wisconsin resident to be eligible for EBD Medicaid. Since Penelope is a Minnesota resident, she would not be eligible. Janice was determined disabled by the DDB, so she meets that EBD criteria by being disabled. Edgar's 68 years old, so he's considered elderly. And Ricardo has been determined blind by the DDB. So again, Ricardo also meets that EBD criteria. Great job, everybody. Now that we've talked about the basic non-financial rules for EBD Medicaid, let's take a closer look at each of the sub-programs in more detail. First, let's talk about SSI Medicaid. The federal SSI program provides cash benefits to people who have little to no income or assets, who are 65 or older, blind, or disabled. SSI has income and asset limits similar to those used for EBD Medicaid. In Wisconsin, if someone qualifies for the federal SSI payment, they will also receive the state SSI payment. Additionally, if someone is getting SSI payments, and we talked about this earlier, they automatically qualify for SSI Medicaid. This means they don't have to apply for Medicaid separately, and their eligibility for Medicaid is not determined by the IM agency. SSI Medicaid is a full benefit Medicaid program. Now let's talk about SSI related Medicaid. This is different than SSI Medicaid, which is that Medicaid someone receiving SSI payments is automatically eligible for, although the coverage for both of these programs is the same since they're both full benefit Medicaid programs. SSI related Medicaid is the basic EBD Medicaid program for people who are elderly, blind, or disabled, as determined by the DDB, but who are not receiving SSI. Eligibility for this program is determined by IM agencies. The income limit for this program is 100% of the federal poverty level. For one person, that amount is currently $1,255. And for a couple, 100% of the FPL is currently $1,703.33. SSI-related Medicaid is outlined in MEH Chapter 24. SSI-related Medicaid also has an asset limit. For a single individual, countable assets must be below $2,000, and for a married couple, countable assets must be below $3,000. If someone is over the income limit for SSI-related Medicaid, they can become eligible for SSI-related Medicaid by meeting a deductible. Deductibles are often also referred to as spend downs. Deductible rules are also outlined in MEH Chapter 24. Medicaid deductibles are calculated for a 6-month period by subtracting that 100% of the FPL from the total countable monthly income in each month of the deductible period, and then adding those 6 remainders together. And again, 100% of the FPL for one person is currently $1,255. So, for example, if a single person's countable monthly net income was $1,355 for each month of their 6-month deductible period, and the income limit didn't change for any of those months, because remember, those income limits are subject to change yearly, they would be $100 over the income limit for each month, and their total deductible amount would be $600 for that 6-month period. Now, there are several ways to meet a deductible. Individuals can submit unpaid and recently paid medical bills, including Medicare and other health and care premiums paid by the person, to meet the deductible. They can choose to prepay the deductible in order to obtain coverage, or they can have a combination of unpaid or recently paid medical bills and prepayment. Information about how to meet a deductible is outlined in MEH 24.7. Once a deductible is met, the individual is eligible for full benefit Medicaid coverage, and Medicaid pays for covered services from the point the deductible is met until the end of the 6-month deductible period, at which time a renewal would be due. So the amount that they use to meet the deductible, they're still responsible for out of pocket, but once they've met the deductible, Medicaid will cover covered services from that point until the end of the 6-month deductible period. Here's an example. Bobby is a single 68-year-old with total countable income of $1,622.50 per month. She applies for health care in July and is over the income limit for SSI-related Medicaid. So the IM agency calculates a deductible period for her from July to December, a period of 6 months. Since Bobby's income was the same for all 6 months, and since the income limit also remained the same for all 6 months, the total amount she is over the income limit for each month won't change and is $367.50 for each month. So the total amount of her 6-month deductible is $2,205. This is the amount she must meet before she can be eligible for Medicaid. On July 6th, Bobby has outpatient surgery and has unpaid medical bills that she does not anticipate any other entity to cover, totaling $3,500 from the procedure. She submits proof of these bills to the IM agency to meet the deductible. By meeting the deductible, she becomes eligible for Medicaid from July 6th, the date she incurred the bill, until the end of December, the end of her deductible period. Again, she's going to be responsible for the portion of the bill used to meet the deductible. So she's still going to owe the hospital $2,205 because that was the amount of her deductible. But the remaining amount of $1,295 can be billed to Medicaid, and Medicaid should pay as long as the bill was for covered services that are covered by Medicaid, also known as covered services. Covered services are outlined in MEH 21.4. And that brings us to our second poll question. Question 2, which of the following is not a true statement for SSI-related EBD Medicaid? A, the asset limit for a single person is $2,000 per month. B, SSI-related Medicaid deductibles are set up for a period of 6 months. C, the income limit for SSI-related Medicaid is 100% of the federal poverty level. Or D, the only way to meet a deductible is to prepay the amount. Again, which of those following is not a true statement for SSI-related EBD Medicaid? We'll give you some time to answer that. All right, looks like a majority of you did get the correct answer. Great job. The answer is D. The only way to meet a deductible is to prepay the amount. That is not a true statement. Prepaying a deductible is not the only way to meet that. Individuals can also submit unpaid or recently paid medical bills to meet a deductible or have a combination of bills and prepayment. Next, let's talk about the Medicaid Purchase Plan or MAP. MAP is a Medicaid subprogram. It's a full benefit Medicaid program, and eligibility for MAP is determined by IM agencies. MAP is for individuals with a disability who are either working or enrolled in a health and employment counseling program, also known as HEC. MAP allows people to qualify as disabled even if they are engaged in what's called substantial gainful activity, or SGA, which means they're earning above a certain threshold. This is different from other Medicaid programs for people with disabilities, where a person cannot qualify as disabled if they are engaged in SGA. MAP has higher income and asset limits to allow members to get healthcare coverage while they're employed. MAP information, including information about the Health and Employment Counseling Program, or HEC, can be found in MEH Chapter 26. The income limit for MAP is 250% of the FPL based on a household that includes the member's spouse, and the member's minor dependent children. Stepchildren are not included in the household size. For example, if Fred was applying for MAP for himself only, and his household included himself, his spouse, and his spouse's minor child with someone else, and a minor child in common, Fred would have a household size of 3, and his income limit for MAP would be $5,379.18 per month. The member and their spouse's net income is compared to the income limit for the household size. So for Fred, his household size was 3, so his and his spouse's income would be compared to that income limit for a household size of 3. MAP allows that $20 standard deduction and $65.50 earned income deduction that we talked about earlier. It also allows an impairment-related work expense deduction, also known as an IRWI, a special exempt income deduction, and a medical and remedial expense deduction, but that's only allowed if the applicant and spouse have medical and remedial expenses that total more than $500 per month. In that case, the deduction would be allowed in the determination of whether Fred's going to be eligible for MAP or not. Premiums for MAP are charged based on the member's income only. If the member's gross income exceeds 100% of the FPL for a group of 1, and remember currently that amount is $1,255, then a premium will be charged. Finally, the asset limit for MAP is $15,000, and only the member's assets are counted. So household size includes the member, their spouse, and minor children of the member only. Net income includes the member and their spouse's income with allowable deductions. Premiums are charged based on only the member's income, and only the member's assets are counted. Before we move on to long-term care Medicaid program information, it's important that we discuss divestment. So divestment is the act of transferring ownership of assets or income and receiving less than fair market value in return. A divestment penalty period is a period of ineligibility for long-term care services based on the amount divested or given away. Divestment penalty rules apply to all individuals receiving long-term care services, except children under 19 years old, children under 22 years old who are enrolled in the Children's Long-Term Support, program, also known as CLTS, and a person of any age receiving residential substance use disorder or SUD treatment in any setting if the person is only there to receive residential SUD treatment. Long-term care Medicaid programs include institutional Medicaid as well as home and community waivers-based programs such as family care partnership, include Respect I Self-Direct, also known as IRIS, Program of All-Inclusive Care for the Elderly, also known as PACE, which is available in Kenosha, Milwaukee, Racine, and Waukesha counties only, and Children's Long-Term Support Program, also known as CLTS. Institutional Medicaid is Medicaid for elderly, blind, or disabled individuals who are living in a nursing home, hospital, or other medical institution. Eligibility for this program is determined by IM agencies. The individual must have either resided in a medical institution for 30 or more consecutive days or be likely to reside in a medical institution for 30 or more consecutive days, as attested to by the medical institution, in order to be eligible for institutional Medicaid. Medical institutions include, but are not limited to, hospitals, skilled nursing facilities, intermediate care facilities, and in some cases, institutions for mental disease. When someone applies for healthcare and indicates that they are in an institution or need institutional care, this is considered an application for institutional Medicaid. There's not a separate application form for institutional Medicaid. Eligibility and cost sharing for institutional Medicaid are determined based on income, assets, the cost of care for the medical institution, and other qualifying expenses. For a single individual, the asset limit for institutional Medicaid is $2,000. For a married individual, some assets may be allocated to the applicant's community spouse. A community spouse is someone married to an institutionalized person and not living in a nursing home or other medical institution for 30 or more consecutive days themselves. Moving on to income, for a single individual, the monthly income is 300% of the SSI federal benefit rate, which is currently $2,829. But they may also qualify if their income is less than their cost of care plus other expenses. For a married individual, some income may be allocated to both the applicant's community spouse and other qualifying community dependents. Qualifying community dependents are outlined in MEH 18.6.1. And divestment penalties may apply, so individuals eligible for institutional Medicaid who are serving a divestment penalty remain open and eligible for card services only while they're in.
So it looks like we've got some more technical difficulties happening today. We are working on getting Nikki's feedback up. Should be hopefully just a minute or two here. Thank you all again for waiting while we keep working on this back end issue. Again, it really shouldn't take too long while we get this figured out.
Okay, do I have everybody back?
I can hear you now. Yes.
Oh, good. Thank goodness. What happened? Not
Gosh,
sure.
who knows?
All right, well, logging out and logging back in helped, and my audio might be a little different because I also stopped using my headset, thinking that might be the issue as well. So, all right. I think that we'll need to put my presentation back on the main stage since I logged out and logged back in. So once that's up, I'll probably have to start sharing again. Sorry.
And Nikki, I would just start that slide over again.
Yeah, I'm going to check with them. Okay, I think we're back in action. So did you hear the financial rules, or do I need to go back to this screen? If you could just put it in the live Q&A.
I think it would be safe to just start with slide 45.
Okay. Got it. Okay. Eligibility and cost sharing for institutional Medicaid are determined based on income, assets, the cost of care for the medical institution, and other qualifying expenses. For a single individual, the asset limit is $2,000. For a married individual, some assets may be allocated to the applicant's community spouse. A community spouse is someone married to an institutionalized person and not living in a nursing home or other medical institution for 30 or more consecutive days themselves. Moving on to income. For a single individual, the monthly income limit is 300% of the SSI federal benefit rate, which is currently $2,829. But they may also qualify if their income is less than their cost of care plus other expenses. For a married individual, some income may be allocated to both the applicant's community spouse and other qualifying community dependents. Qualifying community dependents are outlined in MEH 18.6.1. Divestment penalties may apply, so individuals eligible for institutional Medicaid who are serving a divestment penalty period remain eligible for card services only while in their divestment penalty period. And card services are outlined in MEH 21.4.1.1. While in a divestment penalty period, the individual's long-term care services are not covered. Home and community-based waiver programs enable elderly, blind, or disabled people to receive long-term care services and supports in their own homes or community rather than an institution. Individuals must be eligible for a full benefit Medicaid program or long-term care waiver Medicaid to be enrolled into a home and community-based waiver program, and divestment penalties may apply. Individuals must meet a certain level of care as determined by the Aging and Disability Resource Center, or ADRC. Individuals must contact the ADRC for enrollment counseling and to have their level of care determined. The ADRC will help to identify the most appropriate home and community-based waiver program for the individual. If the individual is already eligible for a full benefit Medicaid program, the ADRC can enroll the individual into the appropriate home and community-based waiver program. If the individual is not already eligible for a full benefit Medicaid program, the individual must submit a Medicaid application to the IM agency. And to find an ADRC in your area, you can follow the link on this slide. Long-term care waiver Medicaid is a specific form of full benefit Medicaid used to enroll individuals in a home and community-based waiver program when they're not eligible for any other form of full benefit Medicaid. Individuals must be elderly, blind, or disabled to be eligible for long-term care waiver Medicaid. Remember, on the last slide, we said that individuals already eligible for a full benefit Medicaid program could be enrolled in a home and community-based waiver program by the ADRC. But if they weren't already eligible, a Medicaid application would need to be submitted to the IM agency. So for example, someone who was eligible for MAP already and wanted to enroll in a long-term care home and community-based waiver program could contact the ADRC directly, and the ADRC could enroll them based on that MAP eligibility, that full benefit Medicaid eligibility. But if they don't already have Medicaid eligibility, they have to also contact the IM agency or submit an application to the IM agency. So the IM worker would then determine eligibility for Medicaid. When they determine that, they check for all other full benefit Medicaid programs first, and then if the individual is not eligible for any of those, they will check for that long-term care waiver Medicaid. The financial rules for long-term care waiver Medicaid are very similar to the rules for institutional Medicaid, including that some assets may be allocated to the applicant's community spouse, and some income may be allocated to the community spouse and other qualifying community dependents, and divestment penalties may apply as well. And that brings us to our next two poll questions. So first, poll question 3, when determining eligibility for Medicaid Purchase Plan or MAP, which of the following is not true? A, MAP has higher income and asset limits than SSI-related EBD Medicaid. B, assets of everyone in the home are counted for MAP eligibility. C, when determining if a MAP premium will be charged, only the member's income is counted. Or D, when determining the MAP household size, stepchildren are not included. Which of those statements is not true? We'll give you time to answer that. Okay. This was a tough one.
Are folks seeing the poll at all?
I believe so. They're answering.
Okay, good. Just want to make sure.
All right. Great job. The correct answer is B. Only the MAP individual's assets are counted, not the assets of everyone in the home. Now, there are rules about joint assets. So if they have a joint asset with a spouse, some of that may be counted as well. And that moves us right into poll question 4. Which of the following is not true for institutional Medicaid? A, medical institutions include, but are not limited to, hospitals, skilled nursing facilities, and intermediate care facilities. B, for a single individual, the asset limit is $2,000. C, some income and assets may be allocated to an applicant's spouse. Additional income may be allocated to other qualifying community dependents. Or D, to be considered institutionalized, the individual must have resided or be expected to reside in a medical institution for 60 or more consecutive days. Again, which of the following is not true for institutional Medicaid? All right. Great job, everybody. The correct answer is D. To be considered institutionalized, the individual must have resided or be expected to reside in a medical institution for 30 or more consecutive days, not 60 days. Now let's talk about those Medicare savings programs in a little more detail. Again, as a reminder, Medicare is not Medicaid. Medicare is that health insurance program run by the federal government that has 5 parts: A, B, BID, C, and D. IM agencies do not determine eligibility for Medicare. Medicare savings programs are Medicaid programs, but they are limited benefit Medicaid programs, not full benefit programs, that help individuals who are enrolled in Medicare pay their Medicare premiums and, in some cases, their Medicare deductibles, copays, and coinsurance. IM agencies do determine eligibility for Medicare savings programs. You may hear these programs referred to simply as MSP, Medicare Savings Program. Sometimes you may hear them referred to as Medicare Premium Assistance, or MPA. Or for those of us that really want to reveal how old we are and how long we've been in this business, like me, you may hear them referred to as buy-in. MSP asset limits are tied to the Consumer Price Index and are updated annually. There are 4 types of Medicare savings programs. The first that we'll discuss today is Qualified Medicare Beneficiary, also known as QMB or QMB. To be eligible for QMB, the individual must be entitled to Medicare Part A or Part BID. The income limit is 100% of the federal poverty level for a group size of 1 or 2. And the asset limit is $9,430 for a single individual and $14,130 for a married couple. Now, if somebody's eligible for QMB, QMB Medicaid pays their Medicare Part A, although most people don't have a Part A premium, Part B, and Part BID premiums, and their Medicare deductibles, copays, and coinsurance. Also, QMB is the only Medicare savings program where the member will get a forward health card if they're eligible, and that's so that they can use that when paying for those Medicare deductibles, copays, and coinsurance. However, this can sometimes confuse members. They think because they have a forward health card, they must be eligible for full benefit Medicaid. But that's not true if they only have QMB eligibility. They only have that card so that they can submit them to their providers for Medicare deductibles, copays, and coinsurance. Some Medicaid members are automatically eligible for QMB. People eligible to receive SSI automatically receive QMB benefits as part of their SSI Medicaid benefits package. So people receiving SSI, remember, are automatically eligible for Medicaid, so they don't need to submit an application to IM for their Medicaid. And they're also automatically eligible for QMB, so they don't need to submit an application to IM for Medicare savings programs either. Some Medicaid members who once received SSI but no longer do are automatically eligible for QMB, including 503 assistance groups and Disabled Adult Child or DAC assistance groups. Both of those are special status Medicaid, and you can find out more information about each of those in MEH 25.1 and 25.2. The next Medicare savings program is Specified Low-Income Medicare Beneficiary, also known as SLMB or SLMB. In order to be eligible for SLMB, the individual must be entitled to Medicare Part A or Part BID. The income limit is 120% of the FPL for a group size of 1 or 2. And the asset limit is $9,430 for a single individual and $14,130 for a married couple. If someone is eligible for SLMB, SLMB Medicaid will pay their Medicare Part B and Part BID premiums only. The next Medicare savings program is Specified Low-Income Medicare Beneficiary Plus, also known as SLMB Plus or SLMB Plus. In order to be eligible for SLMB Plus, the individual must be entitled to Medicare Part A or Part BID. The income limit is 135% of the FPL for a group size of 1 or 2. The asset limit remains the same, $9,430 for a single individual and $14,130 for a married couple. And for this one, the individual may not be enrolled in another Medicaid program, full or limited benefit. If someone is eligible for SLMB Plus Medicaid will also pay their Medicare Part B and Part BID premiums just like SLMB. The difference between SLMB and SLMB Plus is that SLMB Plus has a higher income limit, and individuals eligible for any other form of Medicaid cannot also have SLMB Plus. They must choose one or the other if they're eligible for both. The final Medicare savings program is Qualified Disabled and Working Individual, also known as QDWI. In order to be eligible for QDWI, the individual must be under age 65 and disabled. The individual must have lost premium-free Medicare Part A as a result of returning to work. The member cannot be eligible for any other form of Medicaid. The income limit is 200% of the FPL for a group of 1 or 2. And the asset limit for QDWI is $4,000 for a single individual and $6,000 for a married couple. If someone's eligible for QDWI, QDWI Medicaid pays their Medicare Part A premiums only. Now let's talk about some other subprograms. EBD Medicaid Emergency Services is a limited benefit Medicaid program that covers services needed for the treatment of an emergency medical condition when someone meets all EBD Medicaid program rules except citizenship or qualifying immigration status and having or applying for a Social Security number. So this means the individual must still be either elderly, blind, or disabled as determined by the DDB, or be eligible for presumptive disability, which we talked about earlier, to be non-financially eligible for EBD Medicaid emergency services. As we discussed yesterday, emergency services is not available for childless adults, which are those adults age 19 through 64 who are not living with and caring for a child under age 19 and are not certified disabled or presumptively disabled, children with higher incomes, or women enrolled in the Badger Care Plus prenatal program. While emergency services applications are processed by IM agencies, it's not the responsibility of the IM agency to determine if the applicant's condition is or was an emergency condition and reimbursable under EBD Medicaid emergency services. It is the IM agency's responsibility to manually determine if the non-qualifying immigrant meets all eligibility requirements during the dates of service and to certify that he or she is eligible for emergency services. Medical providers who have treated a non-qualifying immigrant for emergency services may complete the Certification of Emergency for Non-U.S. Citizenship, Form F01162, to verify that the services provided were to treat an emergency medical condition, and the patient can provide that to the local IM agency when applying for assistance, although the form is not required. Additionally, a provider's certification of emergency by completing that Form F01162 does not guarantee reimbursement. When the medical provider submits claims for emergency medical services to the fiscal agent determines if a condition is an emergency medical condition covered by emergency services. More information about emergency services can be found at the link shown on this slide. The Katie Beckett program is a full benefit Medicaid program for children with disabilities who are living at home, in a foster care setting, or in another eligible community-based setting who require an institutional level of care. Because only the child's income is counted, it allows some children with special needs to qualify for Medicaid, even with higher family income when they might not be eligible for Badger Care Plus. Applications for Katie Beckett Medicaid are processed by DHS staff, not by the IM agency. And more information about Katie Beckett can be found at the link shown on this slide. The Wisconsin Well Woman Program, or WWWP, is also a limited benefit Medicaid program. It provides specific preventative health screening services related to breast and cervical cancers. Individuals can apply for the Wisconsin Well Woman Program through their county or tribal Well Woman coordinating agency. More information about the Wisconsin Well Woman Program can be found at the link shown on this slide. Wisconsin Well Woman Medicaid, or WWWMA, is a full benefit Medicaid program for women under age 65 who need treatment for breast or cervical cancer or certain precancerous conditions. So often women may be enrolled in the Wisconsin Well Woman Program, which provides those preventative screenings. And then if breast or cervical or other precancerous conditions are found, they may then enroll in Wisconsin's Well Woman Medicaid for treatment. Eligibility for Wisconsin Well Woman Medicaid is based on enrollment in the Wisconsin Well Woman Program or family planning only services, so no separate income or asset test applies. Applications for the Wisconsin Well Woman Medicaid are processed by Department of Health Services, not by the IM agencies. And more information about Wisconsin Well Woman Medicaid can be found at the link shown on this slide. Senior Care is a limited benefit Medicaid program and provides prescription drug assistance for individuals who are age 65 and older. Applications for Senior Care are processed by DHS staff, not by the IM agencies. For more information about Senior Care, you can follow the link on this slide. And that brings us to our last poll question. Which of the following programs is not a full benefit Medicaid program? A, SSI-related EBD Medicaid. B, Medicaid Purchase Plan, also known as MAP. C, Medicare Savings Programs, also known as MSPs. Or D, Well Woman Medicaid. Which of those following programs is not a full benefit Medicaid program? And we'll give you time to answer that. Again, you can answer those polls by clicking on the poll link in the at the bottom of your page, the live poll. If you're unable to click the link in the and get the live poll to come up, you can also put your answer in the chat. Or the live Q&A, as it's called. Okay. The correct answer is C. Medicare savings programs are not full benefit Medicaid programs. MSPs help individuals who are enrolled in Medicare pay their Medicare premiums and, in some cases, deductibles, copays, and or coinsurance. Looks like a lot of individuals chose Well Woman Medicaid. Remember, there's Well Woman Medicaid, which is full benefit Medicaid, and there's the Well Woman program, which is just covers those screenings. That's the difference between the two of those. Okay, let's look at some additional resources before we answer questions. Online policy resources such as policy manuals, handbooks, forms, and directories can be found by following the first link on this slide, and the specific link for the Medicaid Eligibility Handbook is also shown here as the second link on this slide. So let's go ahead and take a look at our questions for today. And, if we don't have time for all of them, it looks like we should. But as a reminder, you can always submit questions in the future about Medicaid and Badger Care Plus to our Forward Health Partner inbox as well. So I'm going to switch us back over to, I'm going to take a look at the live Q&A here. All right. Does EBD Medicaid emergency services cover chronic conditions? Like, let's say an elderly individual goes to the ER due to a life-threatening high blood sugar from diabetes. Also, are the fiscal agents medical providers or have medical training? So, EBD Medicaid emergency services covers only emergencies, so life-threatening situations. And as to whether a specific emergency will be covered or not, I can't answer that question. The fiscal agents, I'm not sure if they're medical providers or have medical training. I don't know if they just have a list of situations they're allowed to cover.
Yeah. So EBD, emergency services is life-threatening. It all depends on the code that the provider submits. So that's what they review to base their decision. So it depends on the billing code, what the services were.
Thanks, Maciel.
Absolutely.
All right, next question. Do consumers have to reapply for programs that help pay for Medicare Part B every year? No, they do not have to reapply, but they do have to complete their renewal in order for their program to continue. So remember, renewals are due every year for health coverage, including programs that are not full benefit programs such as MSPs. So they don't have to reapply, but they do have to complete a renewal in order to continue to be eligible for their Medicare savings program. All right. When it says asset limits, is that monthly or annual? Those asset limits are monthly asset limits. So they cannot go over $2,000. A single individual, not institutionalized with a community spouse, has a $2,000 asset limit. They're not allowed to, at the end of the month, their assets cannot be over $2,000. They do have to report changes. One of those changes is if their assets go over the asset limit. So that is a monthly, they have to remain under $2,000 every month. How many days are covered by institutional Medicaid? As many days as they're in there. Once they're eligible for institutional Medicaid, they'll be covered by institutional Medicaid unless they are determined ineligible for some reason, like their income or assets go above the limit or they divest. I think you might be thinking about Medicare, because I know Medicare will cover a certain number of days in an institution before a member or before an individual has to apply for institutional Medicaid. So that would be a Medicare question. If they're eligible for Medicaid, there isn't a limit on how many days are covered. And then, oops, that question was not completely answered. I'm not sure where it went. There was another part to that question. Where did it go?
I'm grabbing it. I'm sorry about that.
Okay.
Okay, so the second part, so it says how many days are covered by institutional Medicaid, home/community waiver, and is LTC automatically renewed after 30 days?
Home and community-based waiver programs are for individuals that are continuing to live in the community, generally speaking. And there's not a limit to the number of the days for that either. If they're eligible until they're not for some reason, over income, over assets, or what have you. And then, is long-term care automatically renewed after 30 days? Once they're eligible until they're determined ineligible for some reason, and they will have a yearly renewal. So I think that answers that question. And then, are there any differences between emergency services and emergency services EBD other than being elderly, blind, or disabled? So if you're asking if there's any differences between the eligibility for those two programs, there is no difference other than they have to qualify. They have to be eligible for all the non-financial reasons for both programs other than being a citizen or having a qualifying immigration status and having or providing an SSN. So the difference for EBD is that you have to be elderly, blind, or disabled to be eligible for emergency services as an EBD individual. All right. Any other questions? We've got time. You may have heard, I do want to just mention that MAP premiums were suspended during the public health emergency, but they have now been reinstated, and individuals that don't pay their MAP premium will lose eligibility for MAP at the end of the month that they did not pay the MAP premium for. Any other questions about MAP or any of the other EBD subprograms? Doesn't look like. We're going to give you a little bit more time to. Oh, thank you. Appreciate that, Jean. Oh, question from yesterday. Since the marketplace session ran out of time, will they be offering an additional webinar, or could there be more time added if it's offered next year? I didn't do the marketplace session, so.
Yeah, that is a great question. We definitely went overtime yesterday for the marketplace session. I will work with Adam to see if we can do an additional webinar this year for the marketplace applications. And we can send that out if we are able to do one.
Thank you. We also kind of ran out of time for Badger Care Plus. We didn't have a whole lot of time at the end for questions. So if you do have any Badger Care Plus questions today as well, please feel free. We've got some time left to answer. So
I'm sure they appreciate the long pause because it takes a little bit to type.
type them in. Yeah.
Yeah. Here's one.
If a patient did not sign up for Wisconsin Well Woman program because they had coverage but have since lost their job, would it just be calling Medicaid and getting signed up, or is there anything special to get them into the Wisconsin Well Woman program? Wisconsin Well Woman program is administered, applications are done through the Department of Health Services. Actually, I think that was the county agency. Let me go back to that one. Program, not Medicaid, or so Wisconsin Well Woman program provides specific preventative health screening services, and they can apply through their county or tribal Well Woman coordinating agency. You can find that information at that link shown on that slide. You should be able to take a look at that and see where they would have to submit an application for the Wisconsin Well Woman program. Wisconsin Well Woman Medicaid is a program that they would be put into if they qualify, if they need treatment for breast or cervical cancer or other precancerous conditions that may have been found through Wisconsin Well Woman program. No separate income or asset test applies, and applications are processed by DHS, but they're based on enrollment in the Well Woman program or family planning only services. So to sign up for the Wisconsin Well Woman program, oh, you meant WW Medicaid. Yep. So I would have them first either sign up for a family plan. I would have them submit an application for Medicaid if you think they might be eligible for Medicaid, full benefit Medicaid. But if not, and they want to just sign up for the Wisconsin Well Woman program, they need to contact their county or tribal Well Woman coordinating agency. Or if they want to sign up through family planning only services, that is done through the IM agencies. So they could apply for family planning only services through the IM agency. Hopefully that answers your question. What other pre-can? Oh, go ahead.
Sorry, I also dropped the link to our DHS page in that question, that follow-up answer. So
okay. It says, what other precancerous conditions are counted? Do precancerous conditions that could potentially lead to breast or cervical cancer count? I don't have an answer to that question. That is a question for the Wisconsin Well Woman program, which IM workers don't process. So I don't have an answer to that question, and I'm not sure that we can find an answer to that question.
No, I'm putting that link to that page for you so that you can reach out to your local office.
That's a good idea. Great questions, you guys. Any others? There's any question is a great question. Don't feel like you shouldn't put it in there, or even if it was answered in the slides, we can go over it again. Just want to make sure that you guys are able to ask any questions you want about applying for Wisconsin healthcare programs, about Badger Care Plus eligibility, or about EBD Medicaid eligibility. We really need some Jeopardy music.
and a timer or something too.
Yeah. Well, we've got plenty of time left in the session. We've got 20 minutes, 21 minutes left in the session. So we've got plenty of time to answer questions. If you still have them, I want to encourage you to ask them now while you can. You can always email the inbox later, the Forward Health Partner inbox, but if we can answer it live, we're happy to. What was the website for the toolkits?
For the DHS or the Covering Wisconsin toolkits? I'll post the link of the Covering Wisconsin ones. Covering Wisconsin, perfect. Yes, I will put the link in the chat.
Somebody says they don't have any further events. I think there's another event today, right after this one, right?
Yeah, at 10:30.
Yeah.
Carrie, you might want to reach out to conference services and see why that's not showing up.
Oh, Tia also doesn't have any further events.
All right, we will we'll look into that. See what's going on.
Yep, looks like they all have the same issue. So all right, any other questions about the presentations? Okay.
Some of them are asking for where is conference services. It should be in the initial email that you received with the information to log in today. But I think, thankfully, Elizabeth, we have enough time. Maybe we can send a mass email to those who have registered, letting them know.
Yeah, I would think so.
So just hold tight.
All right. Well, if there are no other questions, you're going to get some time back today. I'm sure everybody could use some time. So, okay. Thank you all so much for your time and attention today. It's been my pleasure to spend time with you the last couple days. I hope you didn't get too sick of my voice. Have a great rest of your conference and have a great day.
All right, and we will get that troubleshooting going for why the next session is not showing up. But we will be back at 10:30 with the Office of the Commissioner of Insurance. So please watch your emails, and we will get everything figured out. Thank you so much.
That will be the notice, right, Elizabeth, via email. So make sure to stay tuned to their emails because Keisha's asking.
I would think so. Let me check with Alina to see if she knows.
I would imagine if they didn't even have any additional events for today, they could just stay logged on for the next session. But I will defer to you.
Yeah, no, absolutely. I'm working on it right now. Okay, so we will have them log off and log back on. And they are calling the help desk at the platform to see why that's not coming up. So either you'll have a new email alerting you to what the plan is, or in your original email, you should be able to log in with the same link that you got this morning. And hopefully that second is going to be showing up.
We have someone in the chat saying they did not receive an email about today. The coworker emailed it to them, but the email that was forwarded is the information that they can use to log back in, correct?
Yes.
All right. Misty,
Oh,
hopefully you still have it.
Someone else says the next session is popping up now. So maybe Nona said that the next session is popping up now. So maybe, hopefully.
Oh, yep.
Yep, logged out, logged back in,
logged
up
back
now.
in.
Yay!
Okay, so that's good.
Great
Thank you.
news.
Thank you. Bye-bye now.
Great.
All right,
Perfect.
have a great day.
Thank you, everyone. We'll see you at 10:30 with OCI.
Yeah, bye-bye.